you're going to be listening to a interview on a local radio station in Birmingham where we had Dr. Catherine Tannahill from Portman Dentex and long-time supporter of the campaign, and Joe, one of our mouth cancer survivors, go and talk to the presenter there about mouth cancer signs and symptoms and their personal experiences with either, in Catherine's case, looking for mouth cancer in patients, or in Joe's case, going through the diagnosis and treatment himself. A really interesting discussion, and I hope that you enjoy.
Catherine, can I just firstly ask you what surprised you about this new research from Oral Health Foundation and how mouth cancer cases have hit a record high in the UK?
It does surprise me. It shocks me. It actually is quite scary that we've now surpassed the 10,000 mark for the first time of new diagnoses. We're seeing it increasing in all age groups, really. So whilst most of those diagnoses are in men over 50, we are seeing it increasing in all age ranges, including people in the 20s and 30s, both male and female. So it worries me because it's actually something that is quite easy to diagnose and easy to treat early. And a lot of the deaths that we're seeing, sadly, from mouth cancer could be prevented. Over 3,337 people in the UK lost their life to mouth cancer last year, and half of the cases diagnosed are at stage 3 and stage 4, where cancer is at its most advanced and most difficult to treat. Whereas if it's spotted early and treated early, it has quite different outcomes.
Well, what's the cause for this increase? What's the main drive behind it?
Most of the cases of mouth cancer are due to lifestyle factors that might be smoking and alcohol, and also the human papillomavirus. And some cases we don't know what's caused it at all. Human papillomavirus has been on the rise for many years and more of an increase recently. So it is lifestyle factors.
And as a dentist, what are the symptoms of mouth cancer and how can people identify them?
Anything that's unusual for you in your mouth or head and neck should be checked. So that might be a mouth ulcer that doesn't heal. Of course, mouth ulcers are normal. People get them from time to time, some more than others, but an ulcer that doesn't heal for 2 or 3 weeks should be checked. Or a red or a white patch in the mouth, or something that feels thicker, different texture, an unusual lump or a swelling in the mouth, head and neck, it should be checked out. I'd really encourage everybody listening to check their own mouth regularly for any of those signs. Nearly half of all people have never checked their own mouth in their life, and most of us don't check our mouth regularly for signs of cancer. And about a quarter of people have no idea that cancer can even develop in the mouth. And we would definitely encourage a routine dental health examination. A mouth cancer check is a vital part of that routine dental health care examination.
And I suppose going to the dentist regularly is quite a good thing as well.
Yes, so a regular routine checkup at least once a year is a good thing. We might spot something that you can't see yourself that's quite in a difficult place to see, or very, very early stages. So having a look is really important, and that early diagnosis is so critical in the treatment for mouth cancer. And as I say, we're still seeing cases being picked up far too late. It's crucial that everybody knows the signs to look out for and regularly checks their mouths and visits the dentist regularly and promptly if there's something before they're due for their routine examination.
I may have asked this question many times to dentists previously, but I'm assuming that all dentists, whenever you visit the dentist for a checkup, that they're looking for these, for signs of mouth cancer as well.
Yes, all dentists will look for signs of mouth cancer as part of that routine examination. Some of us are not so good at telling our patients that's what we're actually looking for, but we will be doing it as part of the examination. And I think as a profession, we're getting better at communicating to our patients that that's what we're looking for, that's what we're checking, and also what are the things that they can do to try and avoid mouth cancer.
Now, I should have asked this question at the beginning of the interview. I'm hoping to have somebody who I can talk to with regard to, who's been diagnosed. Is there any chance of being able to speak to Joe Butler? Possibly not.
There is, yeah, I am here.
Hello, Joe. How are you?
Hi there, I'm good, thank you.
Joe, to tell me about your experience in how you found out about your diagnosis, please.
Yeah, so I kind of got very, very lucky with my diagnosis. So hearing there about obviously signs and symptoms and everything, I went to the dentist just for a regular checkup. Got a dentist that didn't usually see me, and it just happened to be she'd come out of retirement to cover for her husband who was sick. It was Mouth Cancer Awareness Week at that time, and she'd had a discussion with the practice manager that morning about mouth cancer and referrals to the hospital. And I was her first patient. Now I'd had an ulcer infrequently. It wasn't ever there for more than a few days. Certainly not 2 or 3 weeks. And I was very aware of the whole, if it's there for 3 weeks, get it checked out. But didn't really know mouth cancer was a thing. I just thought infection or something like that. But it was only ever there for a few days, but it kept coming back in the same place. And when I was having my checkup, she spotted it and said, "You've got a little scar on the side of your tongue," and asked me about it. And I explained, that it's an ulcer that keeps coming back. And she said, "Well, it's mouth cancer awareness, and we've got to refer a certain amount of people up to the hospital. Do you mind if I put your name forward?" And I didn't see a problem with it. I said, no issue at all. Is it anything to worry about? And she said, "No, doubt it. You're 26. You don't smoke, you don't drink. You're not really any of the risk factors, but we'll refer you anyway." And that's when my journey started.
And how has your recovery journey been?
Yeah, it was tough. I had surgery, so I had surgery to resect part of my tongue. Replaced that with a flap from my arm and a vein and artery from my arm. And then it was discovered. So I also had all my lymph nodes taken out of the left side of my neck, and it was discovered that it progressed into there. So staging was advanced. I then went in for radio and chemo for 8 weeks. Had to learn how to speak again. Had to learn how to eat again. Which took me quite a while. And then, from there on, just strength to strength, really, just getting better. But it's not the same as it was before, but it's taken me a long time to get better, but also to be able to obviously talk about it as much as I do. I still have scars. I still have problems speaking and eating every now and again, particularly certain foods and things. But for the most part, it's been a long road. But yeah, for the most part, I'm sort of there.
And Joe, as a survivor of mouth cancer, what advice would you share with our audience?
Yeah, just echoing what Catherine said, really, about going and getting checked out. It's all well and good being aware of everything and having a look yourself and things, and that's definitely one step. But if there's anything that you are concerned about, if there's anything that's unusual, anything that's different, then go and get it checked with a dentist. Get them to have a look at it. Just mention it to them. Like they do check anyway. But mention it. If there's something that's often there and isn't there at the time you're getting checked, they're then going to miss it. So mention it. Have a discussion with them about it. It's better that they're aware, they've got the information, you've told them, and then you can make decisions from there.
Well, Joe, thank you ever so much for sharing your experience. I'm glad that you're on the mend now.
Thank you.
Catherine, can I just ask you, where can our audience go for more information about this medical issue?
Brian, I would visit mouthcancer.org. There's a huge amount of information there about signs and symptoms, how to do a self-check, and also stories like Joe's, which you can have a good look at and read more there.
That was Catherine and Joe there on Birmingham Local Radio talking about mouth cancer. Come back throughout the month to listen to more conversations.